as I speak, and I commend the government of Egypt and especially His Excellency, the President Abdel Fattah al-Sisi, and my sister, Dr. Hala, for this very aggressive campaign. And the reason I'm here is to visit the command center. And the command center, as Her Excellency the Minister said, is a very simple one, but managing a very complex opportunity, a very complex operation. I was so impressed because it's updated every 10 minutes and it tracks and monitors the progress of the screening and other things related to the campaign. I think this type of command center is very important because it can help you to track progress. Because if you don't track progress, if you don't measure progress, there is no result. So I'm really impressed by what I have seen. The other important thing I was briefed while here is about the training center. This is very important. It teaches in many areas, and we're also building a WHO academy in Lyon, in France, and we will bring the two institutions close, and we will work with this institution because this is older institution and we can learn from this institution because capacity building is very, very important. And having said this, coming back to what I started with, the mid-million Saha, it's not only hepatitis C, it covers the screening of major non-communicable diseases, hypertension, diabetes, and also obesity.
Women's health.
This is very important. And the government is also working hard to tackle cancer. As you know, there are many risk factors that cause cancer or that cause cardiovascular disease. And the reason I'm raising this is the government's commitment is impressive. But the people should also work with the government. Because take cardiovascular and cancer diseases. One of the major risk factors is smoking. And starting from individual and family level, there should be a commitment to lead a healthy lifestyle. And it is as simple as stopping smoking. By being smoke-free, you can prevent cardiovascular disease and you can prevent cancer. So it's the government's commitment and the president's initiative and the population's, the citizens' cooperation and choice to lead a healthy lifestyle that can bring Egypt a better impact. And as you know, smoking is very high in this country, smoking rate. Many adults smoke, millions of adults smoke. And they should know that this is the major cause of cancer and also cardiovascular heart disease we see in this country. So there should be a cooperation from the government, from the people, when the government is really committed. But finally, I would like to share with you about smoking, the definition of smoking. Smoking is a fire on one end, tobacco in the middle, and a fool on the other end. That's the definition. We're actually paying to kill ourselves. And that's true. Quote me on that. People who smoke are paying to die. People are smoking or paying for a cigarette to actually contract cancer and heart disease. So this can really be supported by the media, and the media campaign with the commitment of the government, I think we can change it. And this is up to the individual to choose a healthy lifestyle. And I have been talking to the media since I arrived, but I wanted to stress on this very important issue, which is a problem in Egypt. And the government is committed, and every individual citizen should also commit to address the crisis which is coming because of tobacco. With that, shukran gazilan. So glad to be here. Really a huge and grand campaign is going on. This comes from a grand commitment of the government, from His Excellency the President, and this is a great opportunity for Egypt, linked with the health insurance which started now in Port Saida, and it will move into other 5 governorates. WHO will support on this grand vision, and in the next few years to see health for all, and to see health for all Egyptians, which is really a grand commitment from the government. It will take time, it will need resources, but I know from the commitment I have seen, health for all can happen in Masri. Thank you so much. Shukran gazilan.
Thank you.
Shukran.